Good morning, everybody, and welcome to Thrive, Not Just Survive. I hope you all had a wonderful weekend. The weather was quite nice, at least on Saturday. So I hope you did have a very good weekend. Now, today I want to introduce to you a very, very special guest. I've got Dr. Jamie Freeman-Braganca on. She's a veterinarian in Toronto. And what I wanted to do, because I've had quite a few people talk to me about, well, what do we do at this time for our pets and how do we take care of them? So I wanted to bring Jamie on just so that she could walk us through the things that we need to know and need to sort of be really cognizant about when we are here at home taking care of our pets and how to navigate this time with them. So let me bring Jamie on and we'll get started. Hi, Jamie. Thank you so much for coming on and shedding some light on this amazing topic that I feel like we would never have addressed had we not had this situation come up, right? Like mostly we know how to take care of our pets and we do what we need to do with them. But at this particular time, I want to sort of course, talk to you about a lot of other questions. But the main one I want to start out with is, what are the precautions we can take with our pets during this time?
Hi, Nazira. Hi, everybody. Nice to see you all. And I appreciate you guys and the interest in this topic because it's a really important thing to think about. The first thing that you want to consider is think of your pet as a part of your family. And most of us do that already, but that applies to social distancing too. So just like you would be social distancing from anybody who doesn't live in your household, so should your pet. So you want to maintain at least 6 feet between your pet and other animals or other people at all times until we're at a bit of a lower risk phase of this whole crisis. And then also you want to be prepared. So have things ready for your pet at home. Just like on the human side in the grocery stores, it's harder for us to come by certain things. On the vet side too, we're experiencing certain delays in getting medications and food. So you want to make sure that you allow yourself enough time that you can get more of these things. So if your pet's running out of medication, you want to give it at least a week if you can to order more so that you've got time if there is any delay in the supply chain that you can get that stuff in time. And also, if you can, buy a bit of a larger supply at a time to help reduce how many trips you're going to have going into the pet store or the vet clinic, just to help keep us as safe as possible as well. So us being the staff, but also yourselves, right? And so also, we want to prepare for the worst. So hopefully none of us are going to get sick with COVID. But if that were to happen, we want to make sure that we have a caregiver in place for our pet. So, identify a caregiver, talk to them, and make sure that they agree to taking care of your pet if something were to go wrong. And then you want to make things easy for them. So if you can, have about a month's worth of food and medication prepared so that they can, they're ready to go. Also, if you can have a file with your pet's vet's information, vaccine info, instructions for how to feed them, how much medication they need and when. Those are all really easy ways to prepare yourself right now. And lots of us have time to do that. So
yeah. Absolutely. So let me ask you this question. So let's say, in our day-to-day lives, now that if our pet gets sick, not with COVID, but just ill with something. And I know I had talked to you about when my little one got diarrhea. So I want to ask you sort of what would you suggest for us to do if our pet does develop some sort of illness or something's not right? What should we really be doing at this point?
Right. So vet clinics are still open, just like all the other businesses that are still open. We're serving people in a bit of a different way. So we're trying to maintain human health as much as possible. So we are still permitted to see urgent cases. So if there's anything that's causing the pet discomfort or pain or is life-threatening, absolutely, we want to get that pet into a vet clinic and they will be seen. Now, things like preventative care, so like spays and neuters and vaccines, some of those things can be reasonably postponed because the risk for human health is high. The best way to know if something is a concern is to contact your vet. So just give them a call and say, hey, these are the symptoms. Do I have to be worried about it or not. Right now, vet clinics are offering a couple different options. So one thing would be telemedicine. So if your pet has like a rash or something like that, that could be pretty easy to see with a picture or, over a video conference like this. Whereas if we have a pet that's like not eating or having respiratory trouble, those kinds of things, those pets really need to be seen by a veterinarian. And so you can definitely go in to see them, but you're going to want to call first and have an appointment. And expect some differences. So certain vet clinics will not be allowing people into the clinic, and so it's more of a curbside thing. So they'll get the whole history over the phone, and you'll be able to arrive, call in, someone will come out and take your pet, bring them in, and they can do whatever they need to do. So be prepared for that. And because that process takes a little bit longer than just walking in, it's always good during this time to kind of be kind and be patient. Everyone's just trying their best to keep everybody safe, and that includes our pets too.
Yeah, absolutely. I think that's the key, right? It's just that if we're all going through this and we're not prepared, because this was never something that we imagined would happen, and we're all sort of blindsided by it. So I think it is about maintaining that level of consciousness, just to say, everyone's going through this. We're all kind of figuring things out as we go, right? So everyone, I think, is trying to do their best, right, and keeping sort of that the space safe for everybody.
Exactly.
I have a question for you, and because I've had with other pet owners, just as a mom for a little one. Can a pet actually get COVID, or a dog or a cat? Like, I know there's lots of different information out there, but is that something that is a risk?
Yeah, so this is a bit of a difficult question. So the relationship between pets and COVID-19 is not fully understood yet, and there's new information coming out every day. So it is possible for our household pets to contract COVID, but the risk is much, much lower than what we see in humans. So dogs in particular seem to be really poor hosts for the virus. There's only been a handful of cases worldwide where we've seen dogs get sick from COVID. And we're talking very mild, like flu-like illnesses, right? So not anything requiring ventilators or anything crazy like that. And if you can think about it, think of all the people who've been sick with COVID at home with their pet, where they're in close quarters and not very many pets getting sick. It kind of shows you that this is low risk, but I would never say that it's no risk. Cats, on the other hand, seem to have a little bit higher risk of hosting the virus. So there was a study that came out of Wuhan, and so they did find antibodies for COVID-19 in cats, but none of those cats were actually obviously sick. So they seem to be able to have the virus run through them and get through it relatively well compared to us. There's a bit more information that kittens are more susceptible than adult cats to the virus, which makes sense, right? Just like young people might be, their immune systems aren't fully developed. Ferrets, actually, of our household pets, seems to be the ones that are the most susceptible. Again, their symptoms still pretty mild compared to ours. So fever, lethargy, loss of appetite, but not these big, terrible pneumonias that we're hearing about in people. So I guess the take-home message here is that pets are very low risk, but I wouldn't say no risk. And the mode of transmission for them is similar to how it would be for people. So if they're social distancing like us, and it should be easier to social distance your ferret than it is yourself, then it would be pretty easy to mitigate that risk. Yeah, probably the highest risk for them to get COVID is from you, believe it or not.
Right. So what happens, that's another question, is let's say that if I was to contract COVID, right, would I isolate from, I'm isolating from my family at this point, right, to be that I'm away from them for 14 days. Would I also have to do that if I'm living alone, let's say, with my pet as well?
Exactly, yeah. So if you get sick with COVID, the first thing you'd want to do is social distance from your pet. If you're still well enough to take care of your pet, you can do that in your home. You don't have to send your pet elsewhere. Actually, the best place for that pet is to be at home with you, where you're watching them, and then you're not, putting somebody else at risk, right? So what you want to do if you do get sick with COVID and you're social isolating with your pet is you want to just practice as good hand hygiene as possible. So anytime you're interacting with your pet, washing your hands before and after. Same thing with when you're feeding them. If you can, wear a mask while you're interacting with your pet. So, keeping them in a separate room or something like that for most of the time, except for when you're feeding them, would be a reasonable precaution to take. And you want to just limit that direct contact as much as possible. So as tempting as it is going to be to snuggle them and kiss them during that 14-day period, just for their own safety, you're going to want to hold off on that until you're better. Yeah.
Right. And I guess this is where it comes in, where either, if you can do it yourself or have a plan in place in case that changes, to be able to let, I think the idea of having a file on them is a great idea, so that their information is there in case somebody else has to step in and help out, right?
Exactly.
And I guess that's something that we all should plan anyways, right? In case, not just with COVID, I think that's a great way of keeping things tidy and in order in case there is an emergency and you do need to do that. At least you've got it ready.
Right, or even for yourself, right? If something happens and you need to get out the door, you can grab the file. Or if for some reason you can't get out of the house for a little while, you've got medications and food left over. It's a terrible feeling when you're running to the end of the bag and it's the weekend or they're closed, right? So having that kind of foresight is always good. Now, if you can't, let's say if you're sick and you're in the hospital and you can't take care of your pet, the next best thing is to have somebody who's already in the home with you take care of your pet for you. If that's not possible, then you can have somebody else come into the home and take care of the pet. So if you know anybody who's already been COVID exposed or recovered from COVID, those would be your ideal people, because you're not putting someone else at risk, right? If you don't have somebody like that in your life, which I'd say that'd probably be the case for most of us, what you'd want to do is have the person come in wearing PPE, so masks and gloves, change clothes after they leave your home, practice the same good hand hygiene, so washing appropriately, and then just providing the basic care of the pet. So feeding, medication, letting them out, but not really snuggling, which sucks. But, again, in the short term, it's kind of a necessary evil. Yeah.
Yeah. I guess that's the thing, right? We have to use common sense and really mitigate anything that we really can mitigate in terms of, what our exposures are, how we're exposing others to this space or whatever it is. But it's about, like I said, we've never been through this, so we're all trying to figure it out. But if we can just kind of be abreast and know sort of what's out there, I know we talked about this, but is there somewhere where people can go to get information, maybe read up on this and just kind of keep it active in their space, in their brains, just to say, okay, in case?
Yeah, absolutely. So there is a really excellent blog from one of my professors at the Ontario Vet College. His name is Dr. Scott Weiss, and he will post any new and upcoming information about the COVID-19 situation, and actually any kind of infectious disease that pets can get. He's got really accurate information, and it's interpreted in a way that's super practical for us to interpret. Because obviously, having you guys sit at home and try to read papers, is not really practical, right? And so he has a really good way of just relaying that information, and it's very accurate. And just understanding that science changes all the time. So, try not to get married to ideas and try to be fluid and be able to adapt to new recommendations as they come out. And that's true for human health too, right?
Right. And I think that's something that's really good to highlight, is things are changing, like as they're learning more about COVID and about certain things. I think it's important for us not to just take just the one thing that we perhaps know today, because in 3 days that might be a little bit different. Maybe there's something else that, studies and things that they're doing to inform us. So I think it's good to have, like the blog that we talked about, maybe, as information gets updated, right, we can kind of be in search of this type of accurate information. Like, I also want to caution people. I mean, there's a lot of things out there that may be inaccurate. So you want to sort of make sure, right, that the source that you're getting it from is accurate, because you don't want to be transferring information to others, which it may be inaccurate.
Exactly. Yeah. And everyone is kind of responsible for their own knowledge too. So, if you hear something, trying to go online and finding some reputable sources before you become married to that idea is always, a good way to go. And we see that all the time in the pet industry, right? There's always opinions and stuff that comes out. And so trying to find reputable sources for your info is always a good idea. And this Worms and Germs blog would probably be the number one place, I would say, for pet owners in relation to COVID-19. That's the number one place where you can get info, for sure.
And that's great. So I think, you know what, I will share it. I've got it on the screen now, but after the broadcast, I'll still share it so people have that link to be able to access information. Is there anything, I mean, we've sort of gone over the questions that I've had come up, and is there anything else that you want to touch on or you can shed more light on for us to, as we move forward with this, for just information?
Yeah. So I guess one thing that comes up is we often have clients asking whether or not their pet can give them COVID. So we've kind of already highlighted on this. In fact, the risk is more so to the pet, that you're more likely to give them COVID than the other way around. But it's not theoretically impossible for them to give it to us. And the way that would be happening is kind of the same way that we could be getting COVID off of surfaces. So there's potentially a role for picking up fomites off of the pet's fur and getting infected. And so, you know, the good news is that fur is actually a pretty crappy place for the virus to live compared to a lot of other surfaces. So it's pretty short-lived. And if you follow the kind of general common sense rules, so washing your hands if your pet, after you bring your pet in from outside, that kind of thing, and keeping your pet socially distanced from other animals and people, you should be able to make that risk to you very, very low. Yeah.
Right. Okay. Well, that's really good to know, because I think that sometimes our own mindset, like we worry about it, how it's being contracted back and forth, and we kind of don't know all the answers anyways, right? So we just want to take as many precautions as possible. Yeah. I do have a question though. I know we didn't talk about this, but it's just coming up in my head because I know with Malaika, with my little one, her immunization is up for renewal. Like I'm now a month late. Is that okay to sort of hold off a little bit until we know what's going on?
Yeah, so great question. So the best person to ask about your risk level for your individual pet would be your vet. But some kind of general guidelines that we're using right now is, so for animals who are unvaccinated or are due for their first annual rabies booster, because that's required by law, we're recommending that they get that booster. For animals that have already been boosted appropriately, then they would be much lower risk. The vaccines don't expire on the day. Usually there is a little bit of leeway there. And so right now, the risk to human health being high, where it's reasonable, we are postponing vaccines. But for puppies who are much higher risk of viruses, or again, dogs who are unvaccinated totally, then for those guys, we are recommending vaccinating them. And then in the meantime, until you can get in for your vaccines, trying to keep them in your house and reduce the risk. So keeping them on leash as much as possible, away from wildlife, that kind of stuff is a really, reasonable way, because most of the diseases that we vaccinate for are contracted from wildlife or other dogs, right? So, so that's kind of what you want to keep in mind there, yeah.
Yeah, so I guess the whole idea, again, social distancing is so important, especially if they haven't been vaccinated or they're up for vaccination and you're worried about it. The whole idea of keeping the social distancing going will actually, again, mitigate risk, right?
Exactly.
So keeping them as safe as possible. I really appreciate this, because I think, as now we're over a month, we're in the 6-week mark, right? And people are wondering, as initially it was more, okay, how do we kind of take care of our situation at home with just ourselves and our work situations? But as pets or pet owners, I think it becomes really this can go on for another little bit. And then how do we sort of manage it all appropriately and, right? So I think this is great information for people. I hope that, if there's any questions, that they do go to their vet, make sure that is something they keep the conversation going, so that they have the right information, because the vet would have the history of the pet, right? So they would be able to guide them properly.
Exactly. So they have their vaccine history. They're able to ask you kind of targeted questions about your pet's lifestyle, because it's this weighing balance, right? The risk to human health versus the risk to the animal health. It's really difficult to make those decisions. Luckily, we have our governing bodies have been able to give us some pretty clear guidelines that we can use. And so I would also say to people, if your vet is recommending postponing, a vaccine or a spay or a neuter, understand that it's to help On the human side, we actually use a lot of the same products. So like the same masks, sometimes same gloves and medications that they use on the human side. So us having kind of stripped back to urgent services, it's so that our human healthcare practitioners have what they need to do their job safely. So it's difficult. It's, you know, a hard pill to swallow. You know, a lot of us believe in spay and neuter, and we know it saves lives. So to put that on hold for a couple months is a real punch to the gut. If you do have an animal that's intact at home, so unspayed or unneutered, you'll want to take some extra precautions too at home. So, you know, understanding that male dogs who still have their testicles, they're more prone to roaming. So keeping them on leash or supervised in the yard, making sure you have adequate fencing. For female dogs, when they're in heat, you'll be able to usually tell. Most pet owners are aware when that happens. And you'll want to keep them separated from other intact male animals. And then cats that are intact should always be kept indoors. That's kind of just a good rule of thumb. We're about to enter kitten season, and cats are very reproductively active. One single female cat can have 25 kittens in a year.
Wow.
Yeah, right. And then you think of all those kittens having kittens, we can end up with a lot of cats very quickly. So if you have a cat who is not spayed or neutered, please keep them indoors and help us out with population control for sure.
Absolutely. I think this is great information, even as after COVID, right? Just to kind of be aware of these things and helping sort of the situation, right? So I think this has been amazing. Thank you so much for taking the time and answering some of our questions. And if there's any parting words, I'll give you the floor for a minute or two, and then I will sign off with you. But thank you so much, Jamie. You've been an amazing resource for us.
Oh, no problem. It was my pleasure. And I thank you guys for your interest. They were all really good questions. So I guess moral of the story is social distance with your pet. Think of them as a member of your family. Call your vet if you have any questions. And then just be patient, be kind, and be careful. Stay safe.
Thank you so much, Jamie. I really appreciate it. So I just want to, you know, I hope this has helped for those of you who have pets and have wondered about what to do and how things as we move forward. The other thing is I ask you to share this because you never know, like there's a lot of people that are still essential workers and working that may also want to have this information. So share the video, share the broadcast. You never know who it could help out. So I appreciate your time. I wish you a wonderful, blessed Monday, and I will see you again tomorrow. I do have another very special, very energetic guest tomorrow, so don't miss out tomorrow's broadcast at 10 a.m. I'll see you then. Have a safe one.